Welcome to the Doctors Making a Difference podcast. Today we're joined by Dr. David Moss. Dave has been one of my friends for a lot of years, and I sure appreciate him joining us. So why don't you introduce yourself, Dave?
Thanks, Peter. My name's Dave Moss. I'm a family physician. I've been a family physician for about 15 years now. Graduated med school in 2009. Went to the Uniformed Services uh, University in Washington, D.C., and currently practice at Nellis Air Force Base. I'm a federal employee, but I was active duty for several years. My primary job right now is I'm the medical director for an integrative medicine clinic at Nellis Air Force Base, and then I'm also on the faculty of our family medicine residency.
Well, it's an interesting journey for sure. I kind of want to hear, go back to the young Dave Moss. You know, the first time you and I ever met was our wives were friends. We were in college together. How did you decide to become a family doctor, and how did you decide to do medical school in the first place? I'd like to hear kind of some of that journey, and how you. I know you went to the Uniformed Services Medical
Yep.
School, and I just want to hear kind of a little bit more about how that process went.
Yeah. So interestingly, if I think back to my days in high school, I actually said specifically in high school there were three things I would never do. I said I would never go to BYU, I would never become a doctor, and I would never join the military. So I ended up doing all three.
Yeah, you did.
Uh, But actually, when I started college, I actually had no idea what I wanted to do. Um, and at some point, they made me choose a major. So I sat down with a counselor, and when I was looking at all the different options, I chose exercise physiology because that seemed the most interesting to me. And thinking back to high school, my favorite class was anatomy and physiology. And as soon as I got into that major, I realized that most of the folks in there were pre-med, pre-dental. They were going to be athletic trainers, physical therapists. So that sort of sparked the idea of medical school, and eventually just decided that that felt like the right path for me. So I think it was my junior year of college. So a little bit late in the game for most, but my junior year of college is when I decided I wanted to go to medical school. That put me back about a year. So it was I had a year gap between college and med school, which I actually loved. It was great to have a year off of studying
No
the
doubt.
the school grind. Um, but yeah, in that process of applying for medical schools, my wife's from the East Coast, so we decided that we wanted to go to the East Coast for medical school. And my wife had a couple of friends that she had worked with in her molecular biology lab in college who ended up going to the Uniformed Services University, which is, for those who don't know, it's the only military medical school in the United States. It's in Washington, D.C. It's actually right across the street from NIH, and it's kind of connected to the Walter Reed Hospital, which is the big military hospital, kind of the flagship hospital. Um, and so in talking to them, basically they said, "Hey, it's the only med school that has an application that has no fee." So I said, "Okay, that sounds good." So I applied there and to a few other schools, and then got accepted, or I got an interview at USIS is what we call it. And when I went for the interview, there was about maybe 20 of us that were all on this kind of group interview, and just was really intrigued by the whole concept of military medicine, the idea that you're involved in something bigger than just medicine, that you have sort of a bigger mission and goal. I like that a lot. There was a lot of older students, so a lot of maybe 30% of our class were prior military, so they had had some other career, in the military before applying to medical school. So probably a higher proportion of folks who had families. And at the time, I was married, and we had our oldest was 2 years old. So all of that combined with the fact that they pay for medical school,
No
um,
doubt.
yeah. So not having any debt coming out of school, having a family to support at the time, and just really liking the atmosphere there, really felt like the right place for me. So it was great.
Yeah. Well, I guess, it's one of those hindsight questions. We never know because we only walk one path. But would you do it again? If you had the same choice to make over again, would you go to the military school?
Uh, I would say yes. I loved it. I really, really enjoyed my time there. We had extracurricula that we had to go through, like military specific things, but part of that was just fun. So, for instance, in between my first and second year, we did an exercise. They called it Kirkeshner, was the name of it. But we went out for a week and camped basically, shotguns, rappelled. Uh, we were the fourth years do this big exercise that they call Bushmaster, where they do moulage, and so we were the patients for the fourth years. So they'd put makeup on us, and we'd have broken legs and rashes and all kinds of stuff, and then the fourth year medical students would have to take care of us like they were in a deployed environment. So that was a lot of fun. At one point, we actually we rappelled off of a building on campus. So we had these
Nice.
ropes, and they didn't give us harnesses. We had to take a rope and make our own harness, and then we had to rappel, using that harness that we made. So we had military applied physiology, so we did a lot of stuff with underwater medicine, altitude medicine. So those were all parts that I thought were great, and then just a lot of camaraderie at the school. The other thing I really loved about my training is that USA sends their students all over the country for their clinical rotations, because there's military hospitals all over the country. So during my third and fourth year of medical school, we were in Hawaii for 3 months, Virginia Beach for 6 weeks. We went to Tacoma, Washington for 6 weeks. I spent time out here in Las Vegas. So that was another perk of the medical school I went to. So I loved it.
That's neat. Well, and a lot of the stuff that you just described, people would pay to go
Yeah.
repelling, or
Yeah.
go and travel the world. So there are some pretty neat perks to that, and you don't have to pay for the medical school. So if you love the
Right.
military, and if you love the camaraderie and the environment, sounds like that would be the place to go.
Yeah. Yeah. I can't speak highly enough about that school. I really love it. And I still am on faculty there through the family medicine department. So we have students that come from the school and rotate with us, and it's great to catch up with them and have a great relationship with that institution still.
Neat. Well, a lot of us, me included, have had experience working in a veterans hospital.
Hmm.
Like you said, they're all over the place, and whether it's in medical school or residency, I bet a really high percentage of students have spent some time in a VA medical center at some point in their training, and
Yeah.
it's a fantastic experience. I still think in medical school, I was given more responsibility and autonomy, and thus more learning opportunities in that environment than just about anywhere else in that medical school experience. And so, for my limited little piece of it, I really enjoyed that. And so I can imagine that would have been a pretty good training environment.
Yeah. Interestingly, the VA system and the what we call the DoD, Department of Defense health systems are actually separate.
Mm-hmm.
So if you've spent time in a VA hospital, that is actually distinct from a hospital that would be like on a military base, where your primary patient population is active duty. Whereas at a VA, these are all folks who are no longer in the military. So it is a little bit different experience, but it's very fulfilling to take care of both of those populations. You really feel a sense of giving back, taking care of these folks who've really given a lot to our country. So
Yeah, absolutely. So then after that, I don't remember where you did residency. Was it a military associated residency as well?
yeah, most of the students who go to the Uniformed Services University end up doing a military residency. So they end up doing a residency on a military base. There are some slots that they call it a deferred slot, where they might do a civilian residency and then come back in to a military treatment facility. But most are military residency. So I actually did my residency at Nellis Air Force Base. So I've been at Nellis since the day I graduated medical school, which is unusual. Most people move around a little bit, but so I did 3 years at the Nellis Family Medicine Residency from 2009 to 2012.
Wow. Well, so does that, how did, on the logistics of it, I know if you go to the uniform service medical school, you have an obligation back to be in the military for a time. Does your residency time pay any of that back, or how does that work? Again,
Yeah.
maintained a lengthy career in the military, and it's been a great fit for those people who are in it, and then they are in it for a period of time, and then re-enter civilian workforce. How does it work? How many hours, how many years of duty are they required? And I was curious if like I said, does some of the residency time count toward that?
Yeah, good question. There's actually two paths to medicine in the military. The first is to attend the medical school that I went to, which is Uniformed Services University. The second is to do something called a Health Professions Scholarship, or HPSP. Um, the HPSP program is a scholarship program where you can apply for that. And then if you get accepted to any medical school in the US, so say you go to Stanford or a DO school, it doesn't matter. The military will pay for your schooling. Um, and then you do residency. That time in residency does not count towards your payback. So for an HPSP scholarship, you would owe one for one. So if you do 4 years of the scholarship, you'll owe 4 years back to the military. USUS is a little different because you get paid more during school. So when I was at USUS, I wore a uniform every day and I got paid a full officer salary. I had all the health benefits, all the stuff, housing allowance, etc. The HPSB, you don't wear a uniform. They just pay for your school and they give you a stipend, and then you don't get the health benefits and all that. So USUS actually has a 7 year commitment, whereas HPSB has a 4. The time that you spend in residency does count towards your years in service towards a retirement if you want to do like a 20-year
Right.
career and get a retirement, but it does not count towards your payback to the military.
Okay, so
So
that makes sense.
yeah,
So
so
if,
for
if
me,
somebody
I
was
owed 10 years total from the time I graduated residency. So 3 years of residency plus 7 years post residency.
nice. Well, and again, for someone who is like you have found fulfillment in that military career, it made total sense. And if you can stick with it for 20 years, then you get the military retirement,
Yeah,
which is also a huge benefit.
yeah.
On the flip side, you could also be deployed to anywhere they decide to send you.
Yes, been there, done that. Yeah, for
Yeah.
sure.
Have you had a chance to be deployed with? I mean, only talk about stuff you can, but I was curious if
Yeah,
you've have had that responsibility.
yeah. So I actually was tasked to deploy twice, once to Afghanistan, and then that one got canceled last minute, so I didn't end up going. And then the second time I was tasked to go to Qatar. Um, it's Al Udeid Air Base is the name of the Air Force base we have out there. So I went for 6 months. That was in 2017 and into 2018. They have a small medical clinic slash hospital. And so I was the medical director out there for 6 months. They have mostly outpatient, but they had an OR where they could do some surgeries. So I think we did 2 appendectomies while we were out there. And then they have like a trauma bay, and we did have a small inpatient service. So we typically had 1 to 3 folks who were on the inpatient service, usually for some type of illness or infections, things like that. But that was a great experience. Really enjoyed my time there. Obviously, it's not easy on the family to be gone for 6 months, but again, it's one of those things where if you're in the military, you sort of feel like you have to deploy, like because that's what it's all about, right? Is supporting the downrange mission. So that was a good experience for me.
Oh, that's interesting. So when you were in Qatar, you served as medical director. Did you have, and you're a primary care physician, did you have a team of surgeons and nurses, or I mean, who else comprises a kind of a, like you said, a team like that that's
Yeah.
on site?
So at the time we had myself, we had 2 PAs. Actually, we had 3 PAs. We had 2 internists. We had a surgical team that consisted of a surgeon, a CRNA, an ER doc, and I'm missing somebody on that, and they had a nurse. So that team sort of had a separate mission, but they, when they were around, would help out with the sort of the outpatient side of things. But yeah, that was the team. So we had to cover, 24/7 between all of us, and it was mostly sick call. So there weren't appointments. People would just show up, and
Hmm.
we'd take care of them. So
Yeah, like you said, if you're in the military, everybody pretty much gets a chance to deploy at some point. Do you think you'll have that? I mean, I guess you don't really know, but you're still eligible to go do that again if they call on you, right?
so I'm not now. So actually, when my commitment was up in 2019, so I had served the 7 years. Then I exited active duty, and then I transitioned over to a civilian position. So now I'm a federal employee. So the federal government pays my salary, but I'm a reservist now for the Air Force. And my current position is not really a deployable position. It's called an IMA, but so I do that. But my primary job actually is working in the same place I worked while I was active duty, but now as a civilian. So I wear comfortable clothes to work every day now.
So no more military uniform at work then.
Yeah, just only when I do my reserve duty for about 2 weeks out of the year, then I'll wear a uniform.
Interesting.
Yeah.
Well, so talk a little bit about, if you don't mind, what's it like to be a doctor on a military base? I One of the things I wanted to give a little bit of context. I have some friends who've been in the military,
Hmm.
and one of the things this gentleman I was talking to a while ago said that he really misses about the military is he said it's just these guys that are on active families that are on active duty. He said they are dynamic and vibrant and
Yeah.
excited, and he said that was the thing he missed the most about that group. And I was curious, what are your patients like? Is it mostly folks who are active duty on the Air Force base, or are you taking care of adjacent family members, or who else makes up your clientele?
Yeah. So we have a lot of active duty, obviously, and then we take care of their families, so their spouses, their children, and then we also take care of retirees. So anybody who's retired from the military, and there's a difference between separating from the military and retiring. So retiring generally means that you've done a full 20 years of service. Those folks are eligible to keep their TRICARE insurance, which is as you probably know, is the insurance for the military. So those folks are still eligible for care on base. So we have retirees that we take care of, and their usually spouses as well. So it's a pretty good mix of for a family doc. I mean, we see just like in the community, cradle to grave care. Um, but yeah, I agree wholeheartedly that the best part of my job is the people I take care of, and I don't want to say in particular active duty, but the active duty is a very unique population to take care of because they have such unique occupational stressors, hazards, um, and requirements. So, for instance, things that you don't have to deal with is like, what if an active duty airman is injured and can't do their job? They come to me and say, I can't do my job, and then I have to do the paperwork to tell their command that they can't do their job and for how long. Or sometimes an active duty person will come in and we'll start them on a medication that prevents them from deploying. So then we have to know, okay, what are the things that would prevent somebody from deploying? And if they're prevented from deploying, how do we communicate that to their leadership? And then how does that affect the overall mission? If this person now can't deploy, well, somebody else probably has to. So those are some of the unique aspects of the job. Um, but really, to me, it's an honor to take care of these folks who really, I mean, what they sacrifice, and not just, going to a war zone and being in battle, the toll that it takes on their bodies. If you think about like a weapons loader, these are people who 10 to 12 hours a day are lifting 500-pound bombs, and they're putting them on aircraft. That takes a toll on the body. EOD, explosive ordnance, these guys, are exposed to a lot of risks. And, people who do maintenance on aircraft, they're in awkward positions, turning wrenches. So they come in with very unique injuries, very unique things that we have to help them out with. And that's in addition to all of the mental stress of that's put on these folks through the military. So it's really a unique population, but very gratifying to take care of.
Oh yeah. Well, and Dave, if you think of you can think as we talk here, if you think of any, again, it has to be HIPAA compliant and
Sure.
military compliant. But if you think of any stories specific to that you'd be willing to share, interesting situations you've come across or people you've taken care of, I think it is when I think back on my career, I always think of patients that I've taken care of, and we always like the interesting case, like, oh, that was really fascinating. So,
Yeah,
does
yeah.
anything come to mind right now, or you can think about it here for a minute?
Sure. I mean, lots and lots of examples. I would say the one of the things that you see just a lot of in the military is PTSD. We certainly see that a lot, and you'd be surprised how much PTSD is not related to, getting blown up in a Humvee. There's definitely a lot of that, but like I said, there's just a lot of unique stressors that happen in the military, um, and physical stressors. So, we haven't gotten into it yet, but integrative medicine is one of my passions.
Yeah, go ahead
Obviously,
and jump into it. Yeah, that's fine.
sure. So one of the things that we do, we use a variety of modalities, and we treat a lot of chronic pain. PTSD and pain go hand in hand, so we end up treating a lot of that as well. Um, but I'll give you one example. A pilot, this was a former F-15 pilot who came in, he had neck pain, and you'll find that they all have neck pain of some sort, but he had a very specific pattern of neck pain on the one side of his neck, on the front of his neck. And so, we said, how did that happen? And he said, I can tell you exactly when and how it happened. And he described flying in his jet, doing a particular maneuver, and turning his head against G forces and feeling sort of instant pain in that part of his neck. And then it never went away. So I think he had probably had it for 5, 6, 7 years that he'd had this pain from this particular maneuver. So using some of the techniques that we use in integrative medicine, we were able to address that. And we actually did it by, we do something called the functional releases, or return to the scene of the crime is what we call it, where we put him back into that position, and had him go through the movements that he went through while we did some manual releases. And so we were able to make his pain go away by doing that. But we see this a lot. Uh, there was a bomb loader with back pain, and it happened when he was carrying a bomb. It slipped and fell, and he caught it, and when he caught it, it tweaked his back. So, by going back into those movements, then we were able to do something similar with him. So we do a lot of that in a sort of in our integrative medicine practice, but very unique injury patterns and stressors.
Oh yeah. Well, jump into the integrative medicine just a little bit more. I mean, you're an MD. You went to the
Yep.
uniformed military school, and you went to Nellis Air Force Base for the residency. Did they teach integrative medicine as part of that, or were you in studies? Or how did you come across that and develop that skill set?
Yeah. So when I was a fourth year medical student, my friend and I were looking for easy rotations, like we all do. And so we did a complementary and alternative medicine rotation. And during the course of that rotation, we found out about something called battlefield acupuncture, which is it's an auricular acupuncture technique. So there's these really small needles that you can put in the ear, and they're little gold needles. They look like gold studs, and they stay in the ear for several days at a time. And so we found this course in Orlando, Florida. So we convinced our preceptor to let us go down to Orlando, Florida, and take this 4-hour course, which of
Nice.
course was really a ruse for us to go to Disney World with our families. But we did the course, and it was actually very interesting. And we thought, oh, that's kind of cool. So I started messing around with that, and I would use it on my friends and family. And then I used that a fair amount during residency where I would have a patient, and this is a treatment for pain. So I'd have a patient that says such and such hurts, and I've done all these different things, and I'm like, an intern or a second year resident, and I'm like, I don't know what to do with I don't know what to do with you if you've done pain management and physical therapy. So I would say, well, do you want to try something weird? And I'll stick some needles in your ear. And surprisingly, a lot of patients said, yeah, that sounds great. So I started doing that, and people would feel better. Um, so then fast forward to 2015, there was an opportunity for me to do the full acupuncture training course. It's called the Helms Medical Institute, through the Helms Medical Institute. So I did that training in 2015, and started doing full acupuncture, so all over the body. And just found that A, it's fun to do. B, you get great results. And C, there are so many patients who are looking for alternatives to ibuprofen, you know, opioids and things like that. So um, when I was deployed, that we talked about, I did a ton of acupuncture. Probably 30% of my patients I was doing some form of acupuncture, because they're all healthy, but they're all coming in because they're not feeling well because of injuries and things like that.
Yeah.
Um, Fast forward again to 2018, there was a group that came out to Nellis Air Force Base. Uh, they're called the National Foundation for Integrative Medicine. And they sort of just showed up and said, hey, we have this contract with the government to introduce people to some of these integrative modalities. And people said that you guys are a good place to try. So they showed us several different modalities, and they left some with us to play around with. We did that for about a year. And after a year, said, my colleague and I said, this seems like a really good opportunity. Then we were able to get some grant funding, and we started the integrative medicine clinic in 2019. So
On the base.
on the base,
Oh,
yeah.
neat.
So we've been going strong since then. We use a variety of modalities. The myofascial techniques that I mentioned, we use something called frequency specific microcurrent. This is like external small electrical currents that we can run through the body using specific protocols. We use laser, so low level laser therapy. Most people have heard of red light therapy. It's pretty much the same thing, just a little bit stronger. Um, we also use extracorporeal shockwave therapy, which I think a lot of people have heard of. We've used some pulse electromagnetic devices in the past. We also do a lot of acupuncture. The acupuncture that we do, a lot of it focuses on kind of the psycho-emotional components of pain. We do a specific technique for PTSD that we do a lot of. Um, we also use a device called Alpha Stim, which is a form of cranial electric stimulation that's really good for anxiety and sleep. So we just have a wide array of technologies. Some people would call it energy medicine, but these are technologies that are non-invasive ways to treat pain and the psycho-emotional components that sort of travel hand in hand with chronic pain. So again, very gratifying, very fulfilling, lots of great experiences.
Well, thank you, Dave, for going through that. I'm a primary care doctor, so I see a lot of the same patients who've been through everything. They've had the surgery, they've done the therapy, they've done the
Yeah.
steroid injections, they've been on every pain medication you can think of, and some of them get great results from from those modalities, but others they just don't. And there's really not a great answer outside of some of those integrative techniques. So that's great you've been able to do it. One thing that came to mind as you were discussing that is in the civilian world, everything's about, does the insurance cover it? Does the insurance cover it?
Hmm.
And I wondered how
Yeah.
that influenced, because if you in the military, I think most of what you would do would probably be covered on that, and the patients aren't necessarily
Mhm.
responsible for a specific point by point payment on each thing. Is kind of walk me through that, because I wondered if that influenced your ability to do that care.
Yeah, it's a great question. So military medicine is true socialized medicine. That big scary word that people throw around. But in military medicine, the doctors are paid a salary, and there's no fee for service. So everything that happens within a military treatment facility is free for the patient. Um, there is an insurance component. So, for example, if I want to refer a patient to a cardiologist and there's no cardiologist available on base, then TRICARE will pay for that patient to go see cardiology, a civilian cardiologist out in the community, and TRICARE pays for that. That's the insurance component. If I have a cardiologist in the military treatment facility, then there's no cost. There's no money exchange, I should say. So the patient can go see them. If they go see a cardiologist off base, then there's the typical copays, things like that. But most of the procedures and things are covered. Um, as far as integrative therapies, the list that I just mentioned, most of those things are not covered by insurance. And so in a civilian community setting, those would typically be cash pay, um, which, hopefully at some point, some of those things become more mainstream and insurance will cover them. But because we have those modalities inside of the military treatment facility, anybody who comes to see us, it's no cost to them. Some of the devices are beneficial for patients to use at home. So a lot of them will loan to the patient. And then if it works well, then we can offer to connect the patient with a vendor to purchase that equipment, but the insurance would not cover that. And some of them can be pretty expensive, up to $2,000. So we certainly don't push that, and there's no incentive for us to have patients purchase that equipment, but we make that available to them if that's something that they want to do. So we have a fair number of patients who purchase their own devices that they can use at home. Um, so that's pretty much how the military system works. The VA is very similar. It's kind of true socialized medicine. Everything in a VA hospital is covered, but then the VA insurance would pay for things that can't be done in that hospital.
Yeah, it's interesting commentary because like I said, I was listening to what you were saying, and my patients have gone. The ones who are able to travel or have a little bit of extra resource will sometimes find some of these integrative techniques, and some of it's offered through a physician, and some of it's kind of the Wild West, and there's not a
Yeah.
lot of regulation, and so people get super variable results because they're not going into a place that does a lot of it, or they're getting everything through chiropractic modalities. And again, some of those can be really effective if they're done through a center that does a lot of it and are really good at it. But some of them are really people that are not very well trained, but they come up and say, I have this integrative technique and the state allows me to do it, so come. And so in the outpatient world, at least in rural medicine, I've found that the results on that are super mixed because of the
Mhm.
people that they're going to see, and there's not an insurance coverage. And then there are some of those tech modalities that are really effective, but you have to kind of have people who are able to pay for it. So it's neat that you've been able to find things that work for that specific population, and you've been able to do it in a way that doesn't make them have to pay a whole bunch of money to get it. So that's
Yeah.
neat.
Yeah, there's a lot of our patients are young, 18, 20, young 20s, and an enlisted person does not make that much money. So to be able to offer those modalities to these folks who otherwise would really have no means to be able to pay for it on their own is great.
Yeah. Well, one other thing I wanted to explore on that, as you're saying that, is the link between the physical and the I mean everything's physical in a way, but
Mhm.
between physical and emotional pain,
Yeah.
and there's everybody sees it, we all witness it. It's just interesting to see how, especially in a young, otherwise healthy population in the military, that you see so much of that. And I don't know, as you've done that for a few years, what do you think drives that? Do you think it's mostly emotional, or would you say it's muscle tension, or do you have any ideas,
Yeah.
insights you could share?
Yeah. Obviously, pain is very complex. Each one of us, when something painful happens to our body, there's a host of neurologic processes that occur between the point of injury through the peripheral nerves to the spinal cord and into the central nervous system before our brain puts out an interpretation of how painful it is. And the things that determine your response or your interpretation of how painful something is There's 1,000 things that can determine that. It can be um, how frightening the whole situation is. It can be, um, what the mechanism is. It can be if it's something that you're already afraid of, maybe it's going to be more painful. And then it can get really weird. It can have to do with, your relationship with your mother. It's just, it's so varied. Um, there's a really, really great book, and this book, which is called The Body Keeps the Score. If anybody is interested, I highly recommend it. That book by itself probably has changed my medical practice more than any book I've ever read, any textbook, anything. And it really talks about that connection between the brain, trauma, and pain. And so we see this a lot. I'm not a mental health provider, but we obviously deal a lot with this stuff. My interpretation of what I've read is that the limbic system, which some people call the emotional brain, is sort of that is the link between this chronic pain and these psycho-emotional um, problems that coexist with chronic pain. It's that subconscious part of your brain that holds on to the memory of trauma and connects your brain to your sympathetic nervous system. So if you think about somebody who has PTSD, normally if something traumatic happens to us, like you break your arm or something like that, because of what you know about the world and what you know about the fact that bones heal, you end up with a memory of a broken arm, but there's no emotional response to that. You just remember that it was unpleasant. Sometimes things happen and they are so traumatic that the limbic system holds on to that memory because now it's trying to protect you from future harm. And the way it does that is it connects that memory to your fight or flight response. And then anytime your brain is reminded or thinks it's happening again, so it could be something you see, something you smell, um, something a song, anything, it triggers that part of your brain. And before your conscious brain knows what's happening, your limbic system has already turned on your fight or flight, your sympathetic nervous system. So all these symptoms of PTSD, the hypervigilance, nightmares, depersonalization, these are all symptoms of that core issue, which is your limbic system trying to protect you from future harm from these things that it's holding on to. So um, that is the thing that we most commonly see with these folks. And these traumas can be big, they can be small, they can be a singular event, it can be, you know, a multitude of events that are all, put together. So that's where it gets very complex, and we just have to take the time with the patients to try to tease that stuff out and treat those things at the same time. And when we do that, we see that we can really improve their quality of life.
That's great. I think there's some crossover to the physical touch side of medicine too.
Oh yeah.
I've had a lot of patients tell me, hey, when you did this, when we do some kind of manipulation, or you send them to a physical therapist, and they just that you somebody touched them, and maybe some of it may be just the fact that somebody is touching and communicating with them and not afraid of trying to address their problem, and some of it may be the release of muscle tension. It's hard to say exactly what it is, but there is some healing power in having somebody with a healer touch, and I think
Yeah.
that you're kind of connecting with that whole mindset. So that's pretty neat, Dave. You've been able to do that, and now you've done it for a number of years, and you don't have to worry about whether insurance will cover it. You just take care of it. I like that.
Yeah, it's true. That is definitely a benefit of working in this system.
Yeah. Well, so on that same note, we talked a little bit about medical school, and that when you go with the military route, you don't have to pay for it, and you actually receive
Mhm.
a salary as you go through it, which is neat. A lot of people your age, my age, get to the place in medicine where they say, "Hey, it's nice to be able to have a little bit of a
Yeah.
freedom to choose what I want to do," and you've been able to do that with your patients. Find the areas of medicine you like. But I was curious if you'd be willing to kind of walk us through some of the financial journey that you and your wife have been on as you've gone through that, because you military and residency, and military jobs may not pay as much as civilian jobs in some places, and some people are mad about that, but then you start off without any debt. And so I wanted
Yeah.
to hear kind of your take on that, because I've heard it from both sides.
Yeah, definitely the no financial debt. I've joked with folks in the past who say, your medical school was free, and I say, well, it wasn't exactly free. You know, you were owned for several years as a result. But yeah, it is huge to come out without any debt for sure. Um, I would say the best piece of advice that I ever got when it comes to investing is that good investing is boring investing. And that's, I would say, how we've mostly proceeded. Um, in the military, they have something called the TSP, which is like a 401k essentially. Um, so we've contributed to that over the years and then definitely ramped up our contributions since we've moved to the civilian workforce, which uses the same TSP system. We opened some Roth IRAs early on, and then try to keep cash reserve. Um, in the military and also in the civilian workforce, there are retirement pension programs. So one of the benefits to staying with the civilian workforce with the federal employment is that they provide an opportunity to purchase your active duty years towards your civilian retirement.
Oh,
So
interesting.
yeah, so when I got out of the military, they basically look at how much you got paid during your whole time. They do a calculation, and a percentage of that you can pay in a lump sum. So I paid that lump sum, which was actually quite amazing. So for $20,000, about $20,000, I was able to purchase 10 years towards my civilian pension.
Yeah, think about that.
Yeah,
That's pretty favorable math.
yeah, exactly. Very, very favorable. So I did that. And then being in the reserves also gives me another retirement. So that's two retirements, one from the reserves and then one from my federal position. And the 10 years that I had in the military counts towards my reserves as well. So the math should work out pretty good on that. And that's pretty much been our strategy. And hopefully it works out.
No, I like it. The best strategies are usually, like you said, keep it boring, keep it simple.
Yeah, yeah,
and
exactly.
well, and because again, I've talked to people who've been on the military route or they're considering it and they're saying like, oh, I don't know if this will work, but the big benefit is, hey, you get a pension if you play your
Yeah,
cards right. There's not very many other jobs, not very many physician jobs that actually have a pension at the end of it, but the military does, and you get some pretty neat benefits, like you talked about, working with an interesting population and having the ability to travel and some good health benefits that kind of persist. So it seems like it works pretty well.
yeah. About 5 or 6 years ago, they actually added a second type of pension called the blended retirement system within the military, where you don't have to do a full 20 years and you can basically contribute to something like a TSP with some matching and then have that carry forward. So a lot of people have found that's beneficial too. Um, and then they don't feel this need to do like a full 20 years in the military and they still get something financially out of it. So,
Hmm. Well, thank you, Dave. Well, kind of just backing up just a step here. What would you say to someone who's in residency? Maybe they're in primary care or just any any specialty. It seems like there's a lot of integrative medicine across different specialties. What would you say to
mm.
someone that's in their earlier years, or maybe they're mid career, like you and me? What would you say to someone that wants to get involved in that and says I've found a place that I can help my patients, and how do you what would you tell them how to get that training?
um, I would say pick a modality that seems interesting to you and incorporate it into your practice. Um, Probably in a civilian setting, I'll just throw out an example. Let's say you purchased a shockwave, extracorporeal shockwave machine that can treat a variety of conditions, plantar fasciitis, people that have neck pain, back pain, things like golfer's elbow, tennis elbow, lots of tendinopathy. So it's a really great treatment. So a typical shockwave machine costs something like $20,000. So I would just buy that machine, and you can charge somebody cash for treatments for something like Shockwave, and it'll probably pay for itself in a very short amount of time, and would be a very popular treatment modality. That's probably the way I would start. If somebody's interested in something like acupuncture, that's another great way to sort of get you dip your toes into the integrative medicine waters, so to speak. To do a full training, that's typically somewhere in the ten to $20,000 range, but you'll get usually 300 hours worth of training and be very proficient by the time you finish that training. And this is another opportunity where, maybe you could set aside time and do cash pay, and and I think that would pay for itself pretty quickly too. So there's just a lot of modalities out there. So I'll just pick one, give it a try, see what kind of interest you get, and expand from there if it seems like something that your patients are interested in.
No, thank you. I've found, probably just like you have, Dave, that the variability between what people do within the same specialty is huge. And so
Yeah.
sometimes in the training process, people will say, well, I don't want to be an OBGYN or a family doctor or a general surgeon because I'm only going to do this one thing. And man, it's just so many things. Like you and I are both family docs. There's a huge range on what you can do. You've expanded into this whole different field and take care of a patient population on a military. And I work in a rural setting with all sorts of things, of crazy stuff. And I just got off the ER from being over on call all night. And I know lots of family doctors who have the more suburban 9 to 5 job where you only accept insurance. There's just a huge variety of things. And I would say that within each specialty of medicine, you can find a tremendous number of things to do.
Yeah, a good piece of advice I got early in my career was, and this was military specific, but I think it applies, is that people who are unhappy with their career path generally are the people who let their career happen to them instead of making, their career happen. And that's definitely true in the military, and I'm sure it's certainly true in the civilian world as well, that a passive approach to your career is probably going to end up with you doing things you don't want to do. Whereas a more active approach and seeking out what you want and making it happen is going to make you more fulfilled. So,
Yeah. Sometimes my kids, I've asked them, what they want to do when they grow up. And sometimes they know that their dad is a doctor, and sometimes like, oh, I don't know if I want that kind of schedule and that sort of life. And I'm like, well,
yeah,
you can do whatever you want, but certainly if you get a medical degree, it's not like you're just doing one thing. There's 1,000 different options. Find
yeah,
what you like, and to that end, if you don't want to be a doctor, then don't. But if it's something, if they kind of get this idea, like if I'm a doctor, I'm going to be a small town family doctor and deliver babies and
hmm
work in the emergency room, and maybe they don't want that. But just
yeah,
this conversation alone has proved that there's so many different things a person can do. And I still think it's one of the most versatile degrees a person can get. And so I've encouraged my kids, if you want to do it, if you can figure out a way to do it without going into too much debt, there is a career path. You can help so many people if you can find a way to find something that you're passionate about and then take it whatever direction you want.
yeah. Over the years, I think I've always held a little bit of jealousy of your career because to me, you're like the Norman Rockwell painting of a physician.
Yeah.
Jack of all trades, doing all the fun
Yeah, we
stuff.
do
So,
practice. I practice in a unique location where, I mean, like really every day it's like, well, you might come deliver a baby, you might go
yeah,
fix somebody's broken arm, you might be in the OR delivering doing a C-section, might be doing a scope. There's a lot of stuff
yeah,
that goes. On the other hand, you get to do everything, but on the other hand, you have to do everything.
yeah. And you
That's the
you
tricky
do a
part.
lot of it at 2 in the morning. That's the other
Yeah, no, that's
that's the
it,
other
and that's the
downside.
trickiest part is because you're in a kind of a lower resource environment. I mean, there's a lot of things that come in and they'll say, "Hey, Dr. Crane, we need you to come in and do X, Y, and Z because there's a winter storm and we can't fly so and so out, and you're the only one that can do this, or whichever doctor happens to be around." You get to do it because the person can't go elsewhere. And we work with a variety of specialists in our surrounding communities, but every place from here is at least an hour and a half transportation to get there. And sometimes we live in a cold climate, so it doesn't always work out for people
Yeah,
to be moved right at that time. So there are some times where you get into a situation where you're trying to help somebody out with something that needs attention right then, and you there's things we learned in residency, and I would say one of the things about working in rural medicine is you get to use all of the things you learned. I would
Every little
say
thing.
every little skill. Man. Well, David, it's been fascinating to catch up. Do you have any other thoughts or things you'd want to share with our audience? It sounds like you've had an inspirational career thus far.
Oh, no, I just appreciate the opportunity to talk with you today and anybody who's thinking about military medicine. I do think it's a great route. You'll meet amazing people. I guess one parting thing I'll say when I interviewed at USIS, I it was a colonel, I think he was a pediatrician. He was doing my interview, and I said to him, why should I choose the military? And he said, if you know where you're going to live and you're going to live there for 30 years and you know exactly what you want to do for the rest of your life, then the military is not for you. He said, but if you like to go on adventures, that you're willing to take advantage of opportunities that you don't even know exist right now, then the military is great. And that definitely was my experience. This whole journey into integrative medicine, acupuncture, that was never on my radar. The ability to teach residents in a residency program was not something that I knew existed. And so all these opportunities that the military has given me, I'll always be grateful for them. And I've really enjoyed my time.
Yeah, William. I mean, it sounds exciting, Dave. Like after talking to you, I'm like, oh, that sounds great. It sounds like, I mean, you get all these opportunities, and they kind of take care of you financially. So, there's more than one way to get into medicine and training, but this is a really viable, valid way, and I think it's cool. So, thank you so much for sharing it. I've learned a lot, and I'm sure our audience will really enjoy it.
All right. Thank you.
Yeah, I'll take care, Dave. We'll talk to you later.
Okay.
Thanks. Thanks for tuning into the Doctors Making a Difference podcast. And thank you for what you do to help your patients and your community. Your work truly helps so many people. We produce this content to help you have the tools you need to stay in medicine and to highlight the amazing work being done by physicians around the world. Please note that while I am a physician, and many of the guests on this program are also physicians or other professionals, the discussions on this podcast do not represent my employer or any professional organizations to which I belong. This podcast is for your information and entertainment only, and should not be taken as professional advice. You should seek appropriate professional advice pertaining to your own situation. Please check out more of our content on our website, doctorsmakingadifference.com. Also, please follow, like, or subscribe on your podcast player or YouTube channel, and give us a 5-star rating. It really helps to spread the message. Finally, if you'd like to be a guest on the podcast, or if you'd like to nominate someone else to be a guest, please visit the website or email admin@doctorsmakingadifference.com. See you next time.